Assalamu alaikum. The topic of my today's presentation is pre-anesthetic assessment, and I'm Dr. Mahmouda Wasim, consultant journal and laparoscopic surgeon. So the target audience today will be the postgraduate trainees, interns, and medical students. So we will start with a quote from famous Marie Curie: "Share a general responsibility for the humanity. So our particular duty being to aid those to whom we think we can be most useful." So the learning objectives for my today's session will be identify goals of preoperative evaluation, evaluate these patients with medical problems like cardiovascular and pulmonary, and assess the risk associated with anesthesia. We will talk about the enhanced recovery after surgery, which is an ERAS pathway, and very importantly, the preoperative optimization is very important. So the pre-anesthetics phase start with the patient education in OPD. First, for example, for diet, exercise, smoke cessation. Then we state for the shortened fasting. We do not go for 8 to 10 hours fasting, which also enhance the recovery pathway. Antimicrobial prophylaxis and VT prophylaxis, very importantly, most probably DVT prophylaxis. Starting from some more common cardiovascular problems. So, mostly patients suffer from perioperative, preoperative, and postoperative myocardial infarction. So, what to do with these type of patient? If they are on pacemaker, so put them on asynchronous mode. If they are on digoxin, they have to obtain potassium levels, and if they are on warfarin, stop 3 to 4 days preoperatively. What to do with the patients having pulmonary diseases? The pulmonary diseases like COPD, asthma, obesity. Starting with the pulmonary toilet, antibiotics, and bronchodilation. Bronchodilation should start with the bronchodilators. Pulmonary toilet can be by spirometry and antibiotics prophylaxis. So here is the case of a 55-year-old female on tablet warfarin presented in OPD with complaints of right upper quadrant pain, and we diagnosed her as having cholelithiasis and advised for laparoscopic cholecystectomy. So the answer is given by the button. At the end, there is a summary of what we learned today. Today we learned about perioperative anesthesia assessment, which is very necessary, and identify the risk factors before admitting the patients for any elective surgery, and ERAS, which is early recovery and cost effective enhanced recovery after surgery. Thank you so much.